Welcome to the deep dive. You might think insecticide poisoning is maybe a bit of an old problem, but it's a risk that still, well, it definitely still exists for our animals.
It really does. And while um, organophosphate and carbamate exposures are less common now.
Right, I saw that statistic. Only about 4.5% of insecticide calls to the ASPCA poison control since 2003.
Exactly. But like you said, that's still a significant number of pets getting sick and a lot of worried owners calling in.
Absolutely.
And, the decline is probably good news overall. It likely reflects the EPA canceling some of the really potent older
The
chemicals
newer stuff coming onto the market.
and newer, hopefully safer formulations. Yeah. But the key thing, and this is really crucial, is that those older products, they might still be lurking around.
In the garage or...
Exactly. Garages, gardens, sheds, under the sink sometimes. We're talking about things like chlorpyrifos, diazinon,
Yeah.
phosmet, remember tetrachlorobenphos, carbaryl too. These used to be in animal products.
Wow, okay.
And then you've got agricultural or lawn and garden chemicals. Things like acephate, malathion, carbofuran, methanol. Now, many of those have also faced cancellations or restrictions, but again, they might still be out there.
So for this deep dive then, what's our mission? What do people really need to grasp?
Well, the goal is really to cover the basics of this type of poisoning, how it actually works in the body, why it's, still relevant despite the decrease, and the key things you need to know to keep your animals safe.
Okay, makes sense. So organophosphates, carbamates, what's the fundamental problem? How do they actually harm an animal?
It all boils down to how they interfere with enzymes, specifically enzymes called cholinesterase.
Cholinesterases.
Right. There are a few types, but the main one we focus on here is acetylcholinesterase.
Okay. And its job is...
Think of it like the off switch for nerve signals.
Uh,
Acetylcholine is the chemical messenger, the neurotransmitter that nerves use to talk to each other, and also to muscles and glands.
Got it.
Acetylcholinesterase swoops in and breaks down that acetylcholine so the signal stops when it's supposed to. It cleans it up.
So if these insecticides block that enzyme, block that off switch...
Then you get a traffic jam. Acetylcholine just keeps building up where it sends its messages at the receptors.
And that causes problems.
Big problems. It leads to overstimulation of those receptors, and that's what causes all the toxic signs we see.
Okay. Now, you mentioned organophosphates and carbamates. Is there a difference in how they do this?
Yes, there's a key difference. Organophosphates, they tend to bind to the cholinesterase and then undergo a change, a process called aging. After aging, that bond becomes super strong, often practically irreversible.
Wow, so it really shuts that enzyme down long term.
Pretty much. Carbamates, on the other hand, they also bind to the enzyme, but it's a more temporary thing. It's reversible. The enzyme can eventually shake it off, so to speak.
Interesting. So maybe think of organophosphates as like super glue and carbamates more like sticky tape?
That's not a bad analogy, actually. Organophosphates are often a slower onset, but a longer-lasting problem internally. Carbonators can hit really fast and hard, but the underlying enzyme inhibition might resolve quicker if the animal survives the initial phase.
Okay, so this acetylcholine buildup, this overstimulation, what does that actually look like in a pet? What parts of the body are hit hardest, and what signs should someone watch out for?
The nervous system really takes the brunt of it, mainly because of the overstimulation of the parasympathetic nervous system.
The rest and digest system.
Exactly. But it can be a bit more complex because the sympathetic system, the fight or flight one, can sometimes get involved too, which can confuse the picture initially.
Okay.
Acetylcholine acts on two main types of receptors. You've got nicotinic receptors, which are mostly involved in activating skeletal muscles.
So like movement.
Right. Overstimulate those, and you might see muscle tremors, twitching, or even weakness. Then there are the muscarinic receptors.
And
They're more involved with the parasympathetic targets. Things like the heart, the pupils in the eyes, blood vessels, the smooth muscle in the lungs and the gut, and glands like salivary glands.
Okay, so if that parasympathetic system, the muscarinic part, is going haywire, what are those classic signs we might see?
You often see the classic sisal DDE signs or variations, lots of drooling, that's hypersalivation, vomiting, diarrhea,
Okay.
urination, sometimes defecation uncontrollably. The pupils often get really small, like pinpricks, it's called meiosis, and the heart rate can slow right down, which is bradycardia.
You mentioned the sympathetic system might complicate things, though. How?
Well, sometimes, especially early on, you might see some sympathetic effects that can mask or even seem to reverse the typical parasympathetic signs. Like instead of a slow heart rate, you might briefly see a fast heart rate.
Oh, okay.
It's like the body systems are in overdrive and sending conflicting signals. but the underlying issue is still that major disruption of normal nerve function.
And thinking back historically, what would trigger a suspicion?
Often, it was a link to recent insecticide use. Maybe a flea or tick product applied incorrectly, or maybe the lawn was just treated.
Right.
With carbonates, especially, the onset could be terrifyingly fast. Seizures, respiratory failure, even death could happen very, very quickly.
That's scary.
Yeah. And with some of the older organophosphates, particularly in cats, chlorpyrifos was when we saw this with, you could sometimes see more chronic, lingering signs, like poor appetite, general weakness, muscle twitching that just wouldn't quit for days or weeks.
So if a vet suspects this poisoning, what specific things are they looking for on the physical exam?
Well, they'll be looking for confirmation of those signs we just discussed. The hypersalivation, any evidence of vomiting or diarrhea. They'll check the pupil size. Are they myotic, really constricted? They'll listen to the heart rate is slow, bradycardic. They'll assess the animal's mental state. Are they depressed, lethargic? How's their coordination? Any ataxia, that sort of wobbly gait.
Right.
Muscle tremors are a big one, or fasciculations, those little skin twitches. And of course, are there active seizures? In severe cases, they might have a high temperature, hyperthermia, or be visibly struggling to breathe dyspnea. That can progress to respiratory failure, which is often, sadly, the cause of death.
It sounds like a very serious picture.
It absolutely is.
Yeah.
But it's also really important to remember, not every animal will show every single sign. The presentation can vary quite a bit.
This sounds incredibly dangerous. Are certain cats more likely to get severely ill? Or are there situations that increase the risk? Who's most vulnerable?
Yeah, there definitely are factors that increase susceptibility. For instance, some animals just naturally have lower baseline levels of those cholinesterase enzymes.
So less buffer room, basically.
Exactly. And it's pretty well established that cats, just generally speaking, are more sensitive to these compounds than dogs are.
Why is that?
It often comes down to differences in metabolism, how their bodies process and break down chemicals. They might lack certain detoxification pathways that dogs have. And we tend to see these cases more often in small animals, logically. And geographically, you might see more cases in areas with, say, heavy flea problems or in agricultural zones where these chemicals might still be used, even if restricted.
Are specific breeds or body types more at risk?
That's an interesting point.
Yeah.
Yes, leaner breeds like sighthounds, think greyhounds, whippets, and other racing types seem more susceptible.
Why lean breeds?
Well, many of these organophosphates are lipophilic, meaning they dissolve in fat. So in an animal with less body fat, the chemical might reach higher concentrations in the bloodstream and target organs more quickly. It doesn't get sequestered away in fat stores as much.
Makes sense.
We also see this with lean, long-haired cats sometimes. And very young animals are definitely more vulnerable.
Because their systems aren't fully developed.
Right. Their detoxification enzymes, particularly in the liver, aren't working at full capacity yet. And there's even some suggestion that intact male animals might be more susceptible to certain OPs, though the reasons aren't fully clear.
Okay, what about specific situations, like how people use the products?
Oh, absolutely. That's often where the problems start. A huge risk factor is using multiple products that both inhibit cholinesterase at the same time, doubling up, essentially.
Like a flea collar and a spot-on?
Potentially, yes, if both contain these types of chemicals. Or using a premise spray indoors where the pets walk on it, especially if the floor is damp, they can absorb it through their paws or skin.
Oh, wow.
Incorrect dilution is another one, not following the label instructions and making the solution too strong. And a really critical one, especially for cats, is using a product labeled specifically for dogs on a cat.
Because the concentration is wrong for them.
Exactly. Dog products often contain much higher concentrations or different compounds altogether that can be incredibly toxic to cats. That's a very common scenario, unfortunately.
Okay, so let's say a pet owner or a vet suspects exposure. How do you actually confirm it's OP or carbamate poisoning? What's the diagnostic process, and what else looks similar?
Diagnosis is really about putting the whole picture together. You need the history. Is there a credible story of potential exposure? What were they exposed to, when, how much? Then you match that with the clinical signs the animal is showing.
Right.
And, crucially, you have to rule out other things that could cause similar signs. That's the differential diagnosis.
What kind of things are on that list?
Well, other insecticides, for starters, pyrethrins or pyrethroids, dilamone, fipronil, imidacloprid. These were many common flea and tick products, but they cause different types of toxic effects, though sometimes signs can overlap a bit, like tremors.
Okay.
Then there are other pesticides entirely. Strychnine, which causes severe muscle rigidity and seizures. Fluoroacetate, found in some old rodenticides. Metaldehyde and snail bait causes seizures and tremors. Certain other rodenticides can cause neurological signs too.
And non-pesticide toxins.
Definitely. Things like chocolate or caffeine toxicity. Tremorgenic mycotoxins, which are molds that can grow on old food or compost. They cause tremors and seizures. Even things like ethylene glycol, antifreeze, can cause neurological signs early on.
So quite a few possibilities. Are there specific lab tests for OP carbamate poisoning?
Yes, the key test is measuring the activity of those cholinesterase enzymes, usually done on a blood sample, but sometimes retina or brain tissue if it comes to postmortem analysis.
And what are you looking for?
You're looking for significantly depressed activity. Generally, if the activity level is less than, say, 25% of the normal baseline for that species, it's highly suggestive of exposure to an anticholinesterase compound, like an OP or a carbamate.
But it needs careful interpretation.
Absolutely. You have to consider the whole clinical picture, the exposure amount, the timing, the signs. And it's vital to use a lab that has experience with veterinary samples and provides species-specific normal ranges.
Why species-specific?
Because baseline cholinesterase levels can vary quite a bit between dogs, cats, horses, etc. Using a human lab range would be totally meaningless.
Good point. Any pitfalls with that test?
One major one, especially with carbamates. Remember how their binding is reversible?
Yeah.
Well, that reversal can sometimes happen in the blood tube while it's waiting to be tested or during shipping. So the enzyme activity might spontaneously recover, leading to a false negative result, even if the animal was definitely exposed and poisoned by a carbamate.
Oh, that makes it tricky.
It does. So you can't always rely solely on that test, especially if the history and signs strongly point towards carbamate exposure.
Are there any other diagnostic aids?
Well, there's something called the atropine response test. Atropine, as we'll discuss with treatment, blocks those muscarinic receptors. So if you give a very small subtherapeutic dose of atropine, and you do see the expected effects like an increased heart rate or dilated pupils, mydriasis, it might suggest that the receptors aren't already flooded with acetylcholine, making significant anticholinesterase poisoning less likely. But it's not definitive.
Okay.
You can also try to detect the actual insecticide chemical itself in stomach contents, vomit, tissue samples like liver or fat, even sometimes on the fur if it was a dermal exposure.
Can that confirm it?
Finding the chemical can be very helpful. Confirmation, yes. But a negative result doesn't rule it out. The body might have already metabolized or eliminated the compound, especially if some time has passed.
Okay, so this sounds dire, but treatable. If this happens, what can actually be done? What's the treatment plan?
Acting fast is absolutely number one, especially like we said with those rapid-acting carbamates. Time is critical.
So first things first.
Stabilization. ABC's airway, breathing, circulation, make sure the animal can breathe, provide oxygen if needed, support their heart rate and blood pressure.
And if it was skin exposure?
Decontamination is key. Get that stuff off. Usually involves bathing the animal thoroughly with a mild liquid dish soap like Dawn. It helps break down the oils carrying the insecticide. Then rinse with lots of water. Wear gloves while you do it, of course.
Good point. Then what? Specific medicines?
Yes, there are two mainstays for antidotal therapy. First is atropine sulfate. This specifically counteracts the effects of the muscarinic receptors. It helps dry up secretions, normalize heart rate, reduce gut motility.
So it tackles some of those SLUDDE signs.
Exactly. It manages the muscarinic signs, but it doesn't fix the underlying enzyme problem or the nicotinic signs like muscle tremors.
Okay, what else?
The other key drug, particularly for organophosphate poisoning, is pralidoxime chloride, often called 2PM.
And what does that do?
2PM actually works to reactivate the cholinesterase enzyme itself, especially if the bond hasn't aged yet with an organophosphate. It basically pries the OP off the enzyme.
Oh, neat.
Yeah, but it's most effective if given early, ideally within the first 24, maybe 48 hours after exposure, before that irreversible binding really sets in for OPs.
Wow.
It's less effective or maybe not needed for carbamates because their binding is already reversible.
Okay, so stabilize, decontaminate, atropine for signs, 2PM for OPs. What about other supportive care?
That's hugely important. If the animal is having seizures, those need to be controlled aggressively with anti-seizure meds, like diazepam, maybe pentobarbital, phenobarbital, or even propofol infusion in severe cases.
Keep them breathing.
Absolutely. Oxygen therapy if they're dysmaic or hypoxic. Intravenous fluids are usually essential to maintain hydration, support blood pressure, and help flush the system, especially if they're vomiting, having diarrhea, or not eating.
What about getting rid of ingested poison, making them vomit?
That's tricky. Emesis induction, making them vomit, might be considered only if it was very recent injection. The animal is asymptomatic or only showing mild signs, and the product wasn't a liquid solvent like a petroleum distillate,
Why not liquids?
because those can cause severe aspiration pneumonia if they get inhaled into the lungs during vomiting. So it's often contraindicated. Activated charcoal might be given, sometimes after gastric lavage, stomach pumping, if the animal is already showing significant signs and can be safely anesthetized, to bind any toxin remaining in the gut.
Are there any medications that vets should definitely avoid using?
Yes. Generally, phenothiazine tranquilizers, like aspirin promazine, are avoided. They can lower the seizure threshold and potentially worsen respiratory depression or hypotension in these cases.
Okay.
And while atropine is vital, you have to use it carefully. Overdosing on atropine can cause its own problems like an excessively fast heart rate, agitation, disorientation, even its own kind of respiratory difficulty. You titrate it to effect just enough to control the severe muscarinic signs like excessive secretions and bradycardia.
Got it. So what's the usual long-term outlook? If they get through the initial crisis, do they recover fully? And how do we prevent this nightmare scenario?
Generally, the prognosis is actually pretty good if the animal receives prompt, aggressive veterinary treatment. Getting that care quickly makes all the difference.
That's encouraging.
It is. However, with some of the more chronic presentations, especially those cases in cats involving certain OPs like chlorpyrifos that we mentioned, recovery can be prolonged. It might take weeks for the muscle weakness, tremors, and poor appetite to fully resolve. They need ongoing supportive care during that time.
And prevention feels like the most important part.
It absolutely is. The number one most critical thing is prevention. And that boils down to read the label. Always, always, always carefully read and follow all the label instructions for any insecticide product.
Every single time.
Every single time. Don't estimate doses. Don't mix products unless the label specifically says you can. Follow dilution instructions precisely. Never use these products on animals that are already sick, debilitated, or very young or old unless specifically approved.
And the cat thing again.
And absolutely never use a product labeled for dogs only on a cat. That's just asking for trouble. Also, avoid using multiple different cholinesterase inhibiting products, OPs or carbamates, concurrently or even close together in time on the same animal without veterinary guidance.
Okay. And during recovery.
Close monitoring is key. Watching their heart rate, breathing effort, making sure they're eating and drinking, managing any lingering signs, just close observation and following the vet's discharge instructions carefully.
So wrapping this up then, the main takeaway seems to be, yes, these poisonings are less frequent maybe, but the potential for severe harm from organophosphates and carbamates is definitely still there.
That's exactly it. You absolutely cannot be complacent. Because those older products are still around and the potential for accidental exposure or misuse is very real. It remains a serious threat.
Which leads us to a final thought, something really important for you, our listener, to consider. When is the last time you actually looked, really looked, at the labels on your household pesticides, your lawn and garden products? Do you know what the active ingredients are? Are you crystal clear on the specific precautions you need to take, especially concerning your pets? Taking just a few minutes to check those labels, to be informed, that knowledge is powerful. It truly could prevent a heartbreaking and potentially fatal situation for an animal you love. Thanks for taking this deep dive with us.